All right. Today we are here with my patient, Daniel. Daniel was referred into our office from another patient who knew his wife. When he came in, was diagnosed with diabetes, and he found that out because he ended up in the hospital with a blood sugar over 600. And he was just having a rough time. It's been a couple years now, I think. Yeah, a couple years that he's been diagnosed. He's was taking insulin 3 times a day. He had some peripheral neuropathy in his feet that was pretty severe. So we got him started on a program, got him pointed in the right direction, did the right testing, figuring out what the underlying root causes were for him. And here we are about 3.5 months later. So talk about some of the nice improvements that you've seen since you started care with us.
I have feeling in my feet. I can actually walk, and I don't feel like the next step is having them cut off because of diabetes. On the right path there, I've lost almost 20 pounds. I've learned to eat better, healthier foods. So I have more energy because of that. I think it's also because of the foods that I'm eating too. I think they also are giving me more energy than the junk that I was eating before.
Right.
So I've lost weight, and I feel I've got a big energy drive because of that. Overall, I just feel better, and I feel better knowing that I'm on the right track to get my blood sugar under control and keep it under control, and a way to live with it going forward.
Awesome. Talk about the home unit that you're using for your feet as far as you've been doing that every day.
Mm-hmm.
We use an electrical therapy to help turn those nerves back on and get them working better. And I really think from the first time that I put you on that in office, you noticed a difference even then.
I did. It made a big difference, or saw a big difference right at the very beginning there, and still notice a difference daily. Um, the rebuilder kit, it is making my feet. It is giving my feet the feeling back that I had lost, and I mean they're not back 100%, but they're a heck of a lot better than what they were.
Yeah, you were telling me earlier that the pain itself that you were having is almost 100% gone.
That's correct.
Now we're working on the other side of it, which is okay, then getting the feeling back.
Right.
So
the pain, I don't have the sharp pains. I don't feel like somebody's hitting me in the feet with a hammer anymore or anything like that. Occasionally, but it's very rare now. It's not an every night occurrence. And that's a great thing. And again, I am starting to get the feeling back in my feet as well.
And you're seeing your balance be better, I think, as well, correct?
Yes, ma'am, that's correct.
Yeah. Blood sugar wise, where were you averaging before we got started with you, and where are you averaging now? So in your mornings?
I was my morning time average would be about a 200. I'm still off the charts. Now I haven't had anything over a 150 in probably the last 2 months that I've been coming in. If I had to say I had an average, I'd say my average is a 125 right now.
Fantastic.
It is. It really is.
Awesome. I can't wait to see what your A1C is going to look like. Anything else? I'm sorry.
My A1C, I'm not sure the dates here when I actually had that checked, but the time before last, when I went to my regular doctor, I had a 9.8, I think it was, and I checked it while I was there, and it was a 7.2 before I walked out of the office, and that was all because that's all been within the last 2 months that I had that checked.
Fantastic. Awesome. So, the good news about what we're doing for you, like, as you know, is we reduce, with your doctor's approval, of course, is you were able to reduce your insulin. We're reducing your risk factors for Alzheimer's, because I don't know if most people know this, but if you are diagnosed with diabetes, you're twice as likely to have a dementia. When you're on insulin, you're 4 times more likely to have a dementia, and the more insulin you take, the higher that risk factor goes. So where were you at in insulin when we started with you, as far as how much, and then where are we at now?
When I first came in, I was taking a shot, 7 units before each meal, 3 times a day, and I was taking a basal at about 90 units a day.
So we have 21 plus 90.
Yes, ma'am.
Okay, and where are you at right now?
I'm on 82 on the basal. I don't take anything before my meals anymore.
Fantastic. So we've cut out 21 plus 8.
Plus 8.
Almost 30 so about 25% reduction.
And that may be reduced even more once I get my next A1C back in another month or so when I go back to the
Awesome. Awesome. So my goal for you, best case scenario, is that you're able to come off of all of those medications again with the your doctor's approval, because we get you so well that your body just doesn't need them anymore. And I think we're definitely moving in the right direction. You're making lots of good improvements. Last time I looked at your feet, which were problematic to begin with, you had a lot of the yellowing nails, the thicker nails, and things like that. I can't believe the difference, right there. I
It's
mean,
like night and day. They went from yellow to white again. So
yeah.
it
So
really is a big difference. And I had no idea that was related to the diabetes when I
yes.
first came in.
Yeah, the neuropathy is a big one. I rarely find someone, unless you just gotten recently diagnosed and it's just very early on, I rarely find somebody who doesn't have, neuropathy because of that. So if someone else were in your situation and wanted to break out of just that downward spiral of getting worse over time, because that's what your doctor expects for you to happen,
Yeah.
what would you suggest?
I need to do something. I need to come see Dr. Lawrence. But whether you need to do something no matter what, but Dr. Lawrence, I think, can get you on the right path. I think she's got me on the right path, and I'm excited about that. And I see a bright future. Again, when I first walked in here, one of the things in the back of my mind was that I'd have to have my feet cut off in 2 or 3 years. And I don't feel like that anymore. If nothing at all, that's a burden off of my mind to begin with. But I fully believe that I don't have to worry about that. I'm on the right path.
Fantastic. Good job. Awesome. Hey, thanks for your wonderful testimony. I'm sure it's going to help somebody.
Sure hope it does.